Repair of facial laceration. Facial lacerations are common but require careful repair due to the cosmetic and functional importance of the area. Assessing the patient's overall condition and the extent of the injury. Check for signs of shock, bleeding, and other injuries. Use a septic measure. Apply antiseptic over the laceration like povidone iodine. Anesthesia is crucial to ensure the patient is comfortable during the procedure. Lidocaine or another local anesthetic is injected around the wound site. Wound cleaning with sterile saline solution is essential to prevent infection. All dirt, debris, and contaminants must be carefully removed. Closing the deeper layers, such as the subcutaneous tissue, with absorbable sutures like Vicryl 4-0. Then, close the skin with non-absorbable sutures like Proline 6-0. Then apply Sterastrips on it.